Dr. Ed Zimmerman, Aesthetic Revolution Las Vegas, your friendly neighborhood Dick Duck. Well, welcome to another episode at Wednesday, live at 5. And here we are, just back from a little vacation last week. Thanks for giving me some time off to do a little R&R. We needed it. But we did have fun, and we did put Dick Duck stickers all over someplace out there. So there may be a little competition to find those stickers at some point. Anyway, remember to like, follow, subscribe, join us on Instagram, YouTube, and now X. And we'll start off with, I'm supposed to, before we get to the case of the week, talk to you about our Mother's Day specials. The Mother's Day specials are going up, so if you DM us with your name, your email, your phone number, we'll get you on the mailing list for all the cool Mother's Day specials. So now I can talk about case of the week. So Tuesday, we did a really cool case of the week. We had a gentleman who was in his middle years. Can't tell you what he does, we'd have to shoot you, but he works out a lot, and he's a really cool dude, African American, and he wanted to have his gynecomastia treated after all these years. Now, he never juiced when he was younger, he just worked out. Went on a little on and off testosterone, stuff like that, but never huge amounts, not currently on testosterone. But his physique was such that without a t-shirt, he had these little headlights that poked out. And when he put the t-shirt on, it made it even worse. So we determined there was some glandular hyperplasia there. That's a fancy word for the breast gland in the male that can get bigger for whatever reason. It could just be your genetic inheritance that your parents gifted you with. That's always, dubious. But anyway, it's there. It happens to a lot of guys. Guys, when they get heavier, can, in the periphery and that fat, turn testosterone into estrogen. And so they can get estrogen effect on the breast, and they can develop glandular tissue, and they can develop more breast tissue. So that's sort of what we call bitch tit. You see that in the locker room. Or they can just be heavily padded in that area. Before we do a case like that, we do want to work up and find your baseline estrogen, testosterone, prolactin, LH, FSH, all those kinds of things, to make sure that there isn't a pituitary cause for having that issue, especially if there's galactorrhea or anything like that, breast milk that can happen with guys when they have a hormone imbalance. So anyway, we go through all that, we make sure everything is kosher, and then we can go ahead and talk about the procedure that we actually do. Now, this was a guy who worked out. He'd been a little heavier in his life, so his skin was a little bit lax, but not terribly. His particular concern was that he had smaller areola, and the bulge from the glandular tissue actually made them look like nubs. And he didn't want to have any additional insertion sites or visible scars. So we couldn't put any scars down in the inframammary fold because he really didn't have much of an inframammary fold. And where he had gotten other procedures done in his lifetime, or hernia repair or something, it got dark. So that's called post-inflammatory pigmentation or hyperpigmentation. We didn't want to leave any evidence. So we got kind of ingenious, I think. We had fun with this. We made our 3 to 5 millimeter insertion sites up here in the anterior axillary fold. Excuse me. And that was the way that we put in all the tumescent anesthesia. Tumescent anesthesia is when you fill an area with numbing. Now, he was twilighted by our friendly neighborhood anesthesiologist. We have a 5,300 square foot facility here with a fully accredited operating room. So we're accredited by AAAHC, so it's a national organization. And so we offer full anesthesia for people who need it or want it. And so he was in his happy place, and we filled this area up, filled up the armpit, because the breast tissue and some of the fat surrounding the male breast tends to go up into the armpit, especially into the fold up here. When he flexed, he had big massive biceps and triceps, just a little bit of tissue here that needed to be tightened up. So we figured out how to do that for him without putting a visible incision and reducing the tissue. So anyway, so we filled him all up, then tunneled the area. So there was still a little bit of fat there, a couple of hundred cc's, that I was able to sculpt out the bottom below the pectoralis muscle, especially when he flexed, and into the armpits, and up into this top of the armpit in there. You don't like having that sort of chicken nugget sticking out there when you're flexing. And so was able to numb all that up and then tunnel it. Time out for a quick swig of water. And then go in and do the basic liposuction with a power-assisted rotary cannula. When guys work out, they get really fibrous. The glandular tissue, you're not going to be able to cut that up, even with a rotary cannula. So you're able to level the playing field all around it and have the skin, a thin layer of subcutaneous fat, what we call high def, and then you see the muscle, and then you isolate and the glands become more and more apparent. Once the basic sculpting is done, then we were able to take a CO2 laser. So this is a ultra pulse or super pulse CO2 laser. So it has such a short pulse that it literally vaporizes the tissue without touching it, and able to make an incision about 2/3 of the way around the nipple areolar complex. Leave the back of the tissue on that nipple areolar complex so it has a good vascular supply. Flip it up out of the way, and then use the laser to very carefully dissect around the capsule of the glandular elements. Literally take that out and put it on the table for him. Look like a big old marble on each side. Minimal bleeding because you're operating with a CO2 laser, and then able to go back and complete our liposuction. So went to a smaller size cannula and able to really fine tune the definition over the pecs and back over the traps, and clean all that up with his arms in different positions, sit him up, see what he looked like under gravity. And even though he was twilighted, and he's a big boy, so it took a bunch of people to sit him up, lay him back down, and then we did the magic secret sauce. We used the Renuvion, which is a RF helium plasma device, and that causes the fibroceptal units, those are the threads between the underside of the skin and the muscle covering, to instantaneously shrink down. So we're able to use the Renuvion across the chest, across the pecs, across the axilla, and shrink wrap that all the way down. Then we noticed the nipples, the opening from where the incisions for the glandular elements had been, they got a little bit long. And we wanted to be perfectly round. So we're able to pull the tissue together with absorbable stitches to make that perfectly round, and then close the nipple areolar complex in 2 layers. No visible stitches, no incisions, no extra poke holes down below like we would usually make in days gone by. Everything was done through the nipple areolar complex once that had been lifted up out of the way, and a couple little incisions in the anterior and posterior axillary lines. Then we closed him up with our other secret sauce, and apparently he was out driving today. He was supposed to be taking the week off, but apparently when we went to call and check on him, it sure sounded like traffic in the background. So we'll see. He wants to go back to work tomorrow. We asked people to please take a week off because we need everything to reattach even though they're under compression. We don't want any fluid lakes forming under the tissue. We don't want any seromas, hematomas, anything like that. And so we asked him to take it easy, not be moving around, not be in the gym, and not do any upper body stuff for a minimum of 3 to 4 weeks. The rest of them can go back to the gym sooner, but this needs to settle and have a chance to heal. Can't fool Mother Nature. Anyway, so that was our case of the week. Kind of exciting. When he woke up, he was eager to go and tried to walk out. We usually put people in a wheelchair and get them out to their car, and he was awfully helpful. So anyway, but it was kind of fun. So we wish him well, and we'll kind of keep you up to speed, and hopefully he'll let us post some before and after pictures because they should be pretty impressive. But we'll see how that goes. Anyway, so let's see. We talked about Mother's Day specials. DM us your name, email, phone number, get you on the mailing list. We talked about case of the week. Question from last week. What is TRT and HRT, and what program do we have? So TRT is testosterone replacement therapy. HRT, hormone replacement therapy. You've got more than one hormone in your body. And so testosterone alone, while it's very nice, and while many people do just testosterone, you've got to look at the whole axis of hormones because they all interact, they all balance together. It'd be like playing a keyboard with one finger if all you treated with is testosterone. You got all the other fingers and all the other 88 keys to deal with. So if you're going to deal with hormones in men, you're going to look at thyroid, you're going to look at their DHEA, you're going to look at dihydrotestosterone, you're going to look at their serum hormone binding globulin, because that could be binding testosterone that you give them. You're going to look at their relative level of total testosterone versus free testosterone. There's lots of moving parts here in order to make someone who looks good. You may or may not need to block some estrogen. If they're getting peripheral estrogen conversion, guys need some estrogen. They don't need a lot. So sometimes we'll block them down a little bit, and sometimes we'll leave it alone. Don't put everybody on estrogen blockers. It's not uncommon to find people who are getting lower in testosterone, and we've had people in their 20s. Now we have couch potatoes out there who have decreased their testosterone, but I think we're just producing humans that don't necessarily have as much testosterone into late age as they used to. And without testosterone, you don't have vigor. You don't have the natural antidepressant that the Lord gave you. You don't have the ability to have good erections. You don't have bone density. You don't have muscle mass. You don't have a lot of things that testosterone gives you. Too much testosterone, as you know, more acne, more baldness, steroid rage, things like that. So the important thing is to optimize, don't go over the top. A lot of us physicians who were trained back in the 70s, 80s, 90s, 2000s, whatever, we were taught if it's in a normal range, it's okay. I come from a group of physicians who says, we'd like to optimize you back to the range you were in your late 20s to early 30s, so a little bit after you came off the assembly line. Let's bring your hormones, all the different ones, and supplements together into an optimal format so you feel kind of like what you did then. You have good morning erections, you have erections and you're able to keep them when you want to. You have good skin elasticity, you're able to develop bone mass, etc., etc. Those are all important things as far as a hormone replacement therapy. It's not just testosterone alone. So that's the program we offer. I cater particularly to guys because we do see a lot of them. And women are a lot more complex. They've got more moving parts than guys do. So I leave that to people who have passion for treating female hormones. But there is no reason to go through male menopause, andropause, or really, typical menopause for gals. You don't have to, worry about muscle mass, bone density, irregular bleeding, emotional lability, all those kinds of things, hot flashes, all that stuff. Those are all signs of hormone imbalance in men as well as women. You don't have to go through that. That can be fixed. Now, whether you can get your insurance to cover it, totally something else, because the insurance companies know that they can't charge us for things that Mother Nature makes. They have to have something they can stamp a patent on, and so in order to be able to charge you for things. So when you start using natural rather than synthetic hormones and replacements and things, that's more, in my mind, cohesive with what you need as a human being, rather than putting synthetic things into you and finding ways to do that. It's a little more natural. So, it's not totally homeopathic. Yes, we'd like you to get some reasonable sleep, some reasonable exercise, some reasonable working out, some reasonable meditation, things like that. Doesn't always happen in this world, and we recognize that. But we do the best we can. So that's HRTs. How does someone start with us? It's called pick up the phone. Call, text, send smoke signals, whatever it takes, and talk to one of our staff. They're really good about that. We did the case of the week, and common causes of erectile dysfunction. How do we help? Erectile dysfunction is a multifaceted issue. It may have to do with the blood supply that goes into the corpora cavernosa and the corpora spongiosum. And if you have a blockage or a decrease in that blood supply, then you have to find ways to open it up. So we do a lot of that with cardiac medications. Think about where people are told they have narrowing of the arteries. Those same kinds of arteries that narrow around the heart muscle are the ones that narrow around the supply lines of the corpora cavernosa and the corpora spongiosum, part of the erectile hydraulics, if you will. And so you need to be able to keep those dilated. When you take a Viagra, Cialis, or whatever, those are vasodilators. They open up the vessels that supply the erectile function, and that's why they work. But that's not always the problem. Sometimes you can have a venous leak. So you can put all the blood in you want to, but if you can't shut it off and make it stay there, then there isn't a pill for that. There's an erection ring or erection band, or what they used to call a cock ring, that you can put at the base of the penis to hold it there. But it's got to be fitted to you. It's not a one-size-fits-all. It's just like a nice shirt or a pair of shoes or whatever. depending on your mood and the weather and everything else, you got to find the right size for you at that time. And that can be in combination with things. Now, all these things work better with better testosterone. The HR keys come together. Been a long day. I've been talking all day, so cheers. It's only water. I still have to do charts. So testosterone is important to men and women in order to have erectile function. Prostate issues can cause other issues, especially if the prostate enlarges and impinges on nerves and starts to dampen your ability to have an erection that way. So there are a lot of investigatory things that can be done as far as ultrasounds, looking at the vascular supply, MRIs, looking at the prostate, laboratories that look at testosterone free and total and serum hormone binding globulin and all those things that we talked about. But you got to start somewhere and do it in a rigorous fashion and just track all the way down the road until you find what's wrong, and then you treat it. So those are the basics. Remember, the happiness procedure, yes, we'll talk about that in a second, does not treat erectile dysfunction. That's just to add girth. Happiness, girth. That girth is where it's at. So you may not be able to touch the bottom, but you can beat up the sides all day long if you have enough girth. That gives you a happy partner, hopefully, because there's more sensation, there's more friction, there's more everything going on, so it's good for both of you. Remember to like, follow, subscribe, Instagram, YouTube, X, all those social media things we have out there. And Mother's Day specials we talked about, so DM us and send us your information, and we'll get all those specials out to you if you're in the area and interested. Okay, happiness procedure. So yeah, we did a couple of those today. The happiness procedure, yes, it is a play on words, but it's something we've been doing for nearly 20 years. Started out when I trained in Colombia with Alfredo Hoyos, learning high-def lipo. I was one of the first 25 docs in the U.S. who went down to Colombia to see a different way of doing things because it made enormous sense. What you leave is as important as what you take. The shadows that you create are very, very important in order to show muscles. So if you're looking to have high-def lipo, we do a fair amount of that, a lot of that actually, but those are usually guys from out of the area, because the ones in the area have bellied up to the buffet a couple too many times, and it's tough to make them high-def. We want something that's going to be enduring, so if they're just going to put the weight on that right after we work to take it off, it's not as pretty as it could be. I don't put my name on it. But for guys who do want, or gals who do want high-def, and high-def for gals is really lovely. You can really emphasize the abdominal muscles. You don't have to have cuts like you do with a guy. You can really emphasize the hollows that are there, the inguinal folds really cut in the waist, add a little bit to the top of the booty. Not a Brazilian butt lift kind of ad, because people who are working out, they're going to burn that fat off anyway. But you want to sculpt it so that you lower the waist and give somebody a very long, beautiful silhouette, a very, very chiseled, structured silhouette that looks very much like an athlete, like a swimmer, like a gymnast. That's fun kind of stuff. So, and then you have to shrink wrap the skin if it doesn't have elasticity to it, or pull it on stretch. Remember, when you pull something down, it makes everything more tubular. So you can take somebody who has a beautiful contour, and if you pull everything straight down, it actually just makes it look straight up and down. So be aware of that. Be careful what you wish for. But that's why we have Renuvion. Renuvion is probably the best thing out there these days for contracting and shrink wrapping the fibroseptal network. Happiness procedure, getting back to that. So we did it initially with fat. We put fat in that potential space between the skin that slides up and down the penis and the hydraulics, and we have a special way for doing that and keeping it there that uses some of your own natural elements and things. But fat can be a bit fickle, particularly if you work out, and we started seeing people who'd had fat done elsewhere. Some of the fat was in the wrong place, some of the fat didn't survive, things like that. So we were fixing a lot of things, and not everybody has fat available to fix. Liposuctioning penises is no fun, trust me, done it. But we do have fillers, and the fillers have been around since the early 2000s. They're FDA approved for use on the face. We know them pretty darn well. We know what they can do, we know how they behave, we know how long they last. 3 basic kinds of fillers. Hyaluronic gels is what most people use in lips and under eyes, places that move. They last about a year, give or take, if you put enough in, but they cost about as much or more than an ounce of gold per ounce of hyaluronic gel. So they are not inexpensive and they go away. But for the person who wants a synthetic version of as natural as you can get, hyaluronic gels are a pretty reasonable thing to consider to put in to the area. But they don't last as long. And they're fluffy. So look, it's fluffy. No, that's no fun. You don't want to do that when you're out on the date or in a bedroom. So, when you get Godzilla out, you'd like him to be firm, reasonably firm, and get firmer as you get more excited. So Radiesse, which is a calcium-based microsphere biostimulator, is a filler that we use, or Bellafill, polymethylmethacrylate. So the calcium-based fillers, eventually your body absorbs the calcium, they go bye-byes, and the volume goes bye-byes. But it takes, a year, quarter, year and a half, depends on the person, and you can get a lovely volume to that. You just have to work with people who are pretty much already showers, because growers that accordion a lot, when you have a microsphere filler, you may get clumps, you may get fibrosis, you may get unpredictable asymmetry. So, go to someone else if you want that done that way, but that's not me. If you use a different filler, a long-lasting filler, polymethylmethacrylate, that can stay in the body for years and years and years and years safely. Polymethylmethacrylate is something that we use to make artificial lenses for eyes after cataract surgery. Don't want your lenses disappearing. We used it to hold in heart valves and hip joints and basically glue tissue together and things like that. So we know it's inert as far as the human body sees it. It's FDA approved for use on the face. We use it off-label below the belt, but we've done so for well over a decade with great results. And these cheeks, I put in about 8 years ago after I was on TV being interviewed on the Morning Blend. I saw the B-roll and kind of went, ah! My cheeks have gotten way too thin. Made me look old, made me look haggard, and I fixed it. And I put way more in a Godzilla than I did in both these cheeks together. So we get a nice, fulfilling resolution, if you will, to the issue. The goal is to reach down in the morning, go, this is going to be a good day. I don't have things to worry about, and just go about your business. And it really is good for what's up here. We're not just treating girth, we're really treating the human being, because a lot of people have issues with that. Should they? The reality is the majority of guys I see are in the normal range. We're not taking care of the porn stars very often here in Vegas, even though the porn stars are shooting in Vegas. Really what we're seeing is your everyday guys. We're seeing everyday guys who have average numbers. They're 3 to 4 inches around, occasionally a little bit more, all the way around. That's girth. And they're 3, 4, 5 inches long at rest. And those are average. When you get outside of that, if you get too far gone, you create a Christmas ornament. It's fun to look at, but nobody wants to get around it. So, but for other guys, they're just more aware of it because of society or whatever, and we can help. It's just like the person who's lost their cheekbones, lost their jawline definition, lost their chin. Those are all things that we can take care of non-surgically anymore, and we can help them improve for a while or a long while, years and years and years. So anyway, so that's the half penis procedure. If you have concerns or interest in that, talk to the staff. They're great about that, and they've been with me for hundreds and hundreds of these things, so they know the answers. More water. Okay. Is there anything that can make it longer? That's another question from last week. There is a procedure where you can cut the tendons, if you will, that hold the penis up against the body, so to speak, when you have an erection. But it causes it changes the angle of the dangle. It causes things to be a little unstable and predisposes the shaft more to breakage. Reverse cowgirl is famous for that, as things break and snap. That becomes a surgical emergency. That can cause what's called Peyronie's syndrome or disease, where you get a scar, and it causes, as that scar contracts, that when the pickle gets erect, it can tilt towards the direction of the scar, whatever direction that may be, and it can actually cause some shortening. A little bit of improvement that you get in length from a surgical procedure, 1 to 2 centimeters, probably in most people is not worth the risk, and changing the angle of the dangle and having a visible incision somewhere around the base of the shaft. Now, it can be done artfully, so it's a little harder to see, but we're still pretty much an issue. When you put volume in, it turns a grower into a shower all the time. It doesn't physically make you any longer, but the pickle looks longer all the time. When you have a complete erection, it's still the same length it was going to be, but it's safe. It's held close against the body. It's parallel to the body, so that when you're thrusting, it doesn't get snapped back and broken. If you break one of the hydraulic members, that's a surgical emergency, so that's a concern. So the answer is, I can make it look longer, but it's a little bit like it's all done with mirrors. The reality is it's not longer when you measure it, and we do digital pictures and measure everything, so we can pretty much tell you what's been going on statistically on hundreds and hundreds of guys. Let's see, where else are we at here?
Talk about
Yeah, okay. All right, so I'm getting the message to wind up this week's live at 5. So remember to like, follow, subscribe our Instagram, YouTube, X, all that kind of stuff. Remember, our Mother's Day specials are out there, so if you DM us your name, your email, your phone, some way to get in touch with you, smoke signals, whatever you got, we'll let you in on those specials. They're great for mothers. They're great for anybody who's got a mother to give to their mother, even if it's someone else's mother. It's all good. But yeah, we'll be glad to talk to you, put you on our mailing list, whatever. And stay tuned for next week. We'll have another live at 5, another case of the week and stuff like that. And that's it for now. See you, Felicia.